Hello everyone, welcome back to the channel. Today we are starting a brand new playlist on odontogenic cyst. This introductory video will give you a clear overview what a cyst is, what makes a cyst odontogenic, how they form, and the current WHO classification. This will set the foundation so that all the upcoming videos like radicular cyst, dentigerous cyst, and OKC become super easy to understand. So let's get started. Kramer in 1974 gave one of the most widely accepted definitions of a cyst. He described it as a pathological cavity that contains fluid, semi-fluid, or even gas, and importantly, it is not formed by the accumulation of pus. In most of the cases, cyst is always lined by epithelium, but there are few exceptions in the oral and maxillofacial region, which includes examples like mucus extravasation cyst, the aneurysmal bone cyst, and the solitary bone cyst. Since these cavities lack an epithelial lining, many pathologists prefer to classify them as pseudocyst instead of the true cyst. Additionally, Reichert and Philipson suggested using the term cavity for these lesions such as aneurysmal bone cavity to avoid confusion. But for the purpose of studying odontogenic cyst, remember, most of them are true cysts with an epithelial lining. So now that we understand what a cyst is, the next question is, what makes a cyst odontogenic? In simple terms, a cyst is called odontogenic when it originates from the tissues that were involved in the tooth development. During odontogenesis, several epithelial structures are formed, and even after the tooth is completely developed, tiny remnants of these epithelial tissues remain in the jaws. These remnants can later proliferate and form cyst. The main epithelial sources are the res of Melissus, which comes from the Hertwig's epithelial root sheath, the res of Ceres, which are the remnants of the dental lamina, the reduced enamel epithelium that covers the crown of an unerupted tooth, and other components of the enamel organ. So, in short, odontogenic cysts come from the very tissues that helped form your teeth. Odontogenic cysts are extremely important in oral pathology because they are among the most common cystic lesions of the jaws. Many of them grow slowly and silently, so patients not even notice them until they become quite large. Even though most odontogenic cysts are benign, they can still cause significant amount of jaw expansion, tooth displacement, root resorption, and sometimes even pathological fracture of bone. Some cysts like the OKC are known for their aggressive behavior and high recurrence, which makes the accurate diagnosis essential. Knowing the basics of these cysts helps clinicians detect them early, manage them properly, and prevent complications. That's why understanding odontogenic cysts is a core part of oral pathology. Now let's understand how odontogenic cysts actually form. Even though each cyst type has its own features, the basic mechanism revolves around the behavior of epithelial remnants trapped within the jaws. The first concept is the epithelial proliferation theory. Here, dormant epithelial rests begin to multiply. As the central cells get further away from the nutrition, they undergo degeneration. This breakdown leads to a hollow area which eventually fills with fluid, forming a cystic cavity. Another mechanism is the osmotic pressure theory. As epithelial cells degenerate, the breakdown products increase the osmotic pressure inside the cavity. This will cause drawing in of the fluid from the surrounding tissues, causing the cyst to slowly enlarge. In inflammatory cyst, particularly radicular cyst, inflammation triggers the proliferation of risks of malices. So in these cases, inflammation acts as the driving force for cyst formation. There are also developmental mechanisms where cysts form simply because remnants from the tooth-forming tissues continue to grow even without inflammation. Together, these theories help explain why and how cysts expand inside the bone. In 2022, the WHO released the latest edition of WHO classification of head and neck tumors. This update includes a refined classification of odontogenic cyst. The WHO 2022 system keeps the cyst grouped into two major categories: inflammatory odontogenic cyst and developmental odontogenic cyst. Under the inflammatory cyst, there are two main entities: radicular cyst and residual cyst. While in developmental odontogenic cyst, these are more diverse and arise from the remnants of tissue involved in the tooth formation. These include dentigerous cyst, odontogenic keratocyst, lateral periodontal cyst, glandular odontogenic cyst, gingival cyst, and orthokeratinized odontogenic cyst, which is distinct from the OKC and is recognized as its own entity. The 2022 classification is clear, simple, and clinically very relevant, and it forms the basis of how we understand odontogenic cysts in current oral pathology. Before we finish, let's look at some general radiographic patterns seen with odontogenic cyst. Most odontogenic cysts appear as well-defined radiolucencies, often with a corticated border, which helps distinguish them from the infections or other tumors. A large number of developmental cysts like dentigerous cyst, lateral periodontal cyst, and OOCs are typically unilocular radiolucencies. Some cysts, especially the OKC and the GOC, may show a multilocular or scalloped pattern, giving them a more aggressive appearance. As in this slide, you can see a radiograph. This radiograph represents a case of glandular odontogenic cyst. The location can also give us some clues. A periapical radiolucency typically suggests a radicular cyst. A pericoronal radiolucency around an unerupted tooth is often a dentigerous cyst. A radiolucency in the posterior mandible, especially in the ramus area, may point toward an OKC. And in this picture also, as the lesion is crossing the midline, so it also gives a clue that it is a case of GOC. This is just a brief overview. Each cyst has its own detailed radiographic features, which we will explore in the coming individual videos. And that brings us to the end of this introductory video on the odontogenic cyst. Today we covered the essential foundation, the definition, the origin, the theories, and the updated WHO 2022 classification. From here onward, we'll be taking a deep dive into each cyst individually, starting with the radicular cyst and many more. In each of the videos, we'll look at the etiology, pathogenesis, clinical and radiographic features, histopath, treatment, and how to differentiate them in exams and viva. If you found this video helpful, don't forget to like, share, and subscribe, and be sure to check out the next video in this playlist, where we will begin with the most common odontogenic cyst, the radicular cyst. Thanks for watching, and I'll see you in the next lesson.